Welcome to OsteoWarriors, everybody. That's with a capital TEA, where OsteoWarriors in treatment and recent survivors spill the tea on all things osteosarcoma and cancer from the adolescent and young adult patient perspective. Listen in on our honest and personal conversations about our osteo experiences, stories, and who knows what else. We get sidetracked a decent amount. This podcast discusses all aspects of the young adult cancer experience in a conversational format. Audience discretion is advised. Please like and follow MIB agents on social media for all the intel and hot goss.
Registration is now open for Factor 2024, our annual osteosarcoma conference from June 20th to 22nd in Cleveland, Ohio. Very exciting. Registration is $335 for individuals and free for OsteoWarriors ages 8 through 22. We've got scientific sessions. We've got Warrior HQ. We've got a wellness check. We've got therapy bunnies, maybe. I don't know if they're coming back, but I really hope they are. What more could you guys ask for? Serious. What more could you guys ask for? It's best time of the year, and you do not want to miss out. Visit mibagents.org/factor-conference to learn more and register today.
Yes, I love Factor. It's always so much fun. I am hoping that I'll be able to go this year. My fingers are crossed. And it's always a great time to, meet fellow osteo warriors and just, sometimes your oncologist shows up and you get to have dinner with them or something, and it's like a whole different side to them. It's a really, there's some great panels. It's a great time. So also a great thing that we have going on at MIB, we are calling all gaming warriors and siblings, coming soon to a console or PC near you. MIB's weekly gamer agent tournaments with great prizes for registered members only. If you're not yet a registered gamer agent, please sign up, and our wonderful lead gamer agents will welcome you to the MIB Discord server, where you can game with new and old friends in our OS community. Please visit mibagents.org/agents/gamer agents to learn more. So everybody, welcome back. And we are going to be talking about our patient experiences with different lung surgeries today. Some people might not know what is lung surgery for osteosarcoma. I thought it was bone cancer. Completely valid question. Why is it used and what does it imply? Obviously, before this, I want to quickly mention we are not medical professionals. We cannot provide medical advice. We have learned a lot through our personal experiences of receiving treatment ourselves. And this episode is to share our experiences and provide tips on how we handled lung surgery. So osteosarcoma, if you didn't know, commonly metastasizes to the lungs, and there are multiple procedures and surgeries that doctors use to treat or remove these lung tumors. Usually, if your oncologist is suggesting a lung procedure or surgery, it most likely means that there are lung metastases or tumors that have spread from their original location that they want to have removed from your lungs. So today, we have a fantastic group of guests who are sharing their experiences with lung surgeries and procedures. So, what's the tea? Like literally, today I am here with my Man I Love Felines mug, and I'm drinking white tea, which it's now room temperature, so I'm going to give it a 7 out of 10. But my name is Mia. I co-host OsteoWarriors with Camille, if you don't know me already. I just turned 25. I'm from LA. I am currently not doing anything other than focusing on my health and osteo and just spending time with my loved ones. I was diagnosed with osteo in September of 2018. It started in my right proximal tibia, has spread to my lungs, pelvis, spine, scapula, and lungs. Probably forgetting something in there. And I've had 2 thoracotomies and probably at least 100 tumors taken care of by cryogenic ablation, which we can talk about more later. And yeah, Cam, you want to start next?
Yeah, sure. Hey, everyone. I'm Camille. I co-host OsteoWarriors with the wonderful Mia, of course. I'm 21. I'm from right outside of Boston, Massachusetts. I am currently a student at Boston University majoring in psychology and brain sciences. I was diagnosed with osteosarcoma in my right tibia in 2013. It had already spread to both of my lungs by the time it was found. Since then, I have relapsed 8 times, all in my lungs. So I am no stranger to thoracotomies and radiation. I have had 8 thoracotomies. Don't recommend that many. We'll talk about that more. We'll talk about more of that later. But uh, what am I drinking today? Guys, I raided my cabinets trying to look for tea, and they're all expired. And I'm like, I don't really know if tea technically expires, but I was like, I'm not gonna risk it,
They're plants.
especially given that I finished chemo 6 months ago and just stopped Bactrim um
Yeah, take it safe.
last week.
Take it
I'm
safe.
taking it slow, but maybe this is worse. I'm drinking kombucha today, which like is, uh like living bacteria and probiotics, but it's the watermelon wonder flavor. It's my favorite flavor from Synergy. I would say 9 out of 10. It's just a little lukewarm because I took it out of the fridge a little bit ago, but that's what I'm drinking, and that's the tea. Walker, I'll pass it off to you.
Yeah, hi, my name is Walker. I'm from Kentucky. I go to the University of Kentucky. My osteo background is I was diagnosed in 2018 and then finished MAP and chemo and everything in 2019. And then in 2020 had a lung recurrence and then have been NED since then. Uh, the tea is water today in a MIB water bottle. So
Yeah.
normally, I
Nice.
would say 5 out of 10 for room temperature water, but because of the bottle, I go 7 out of 10.
Nice.
So two
Nice.
points for the bottle.
Designed by me, by the way. We might,
Oh, there you go.
might
Okay.
say.
Our
And
So
multifaceted queen.
I almost actually used that water bottle today. That's kind of sim. But anyway.
but I think that's it. So I guess Penelope, you can go.
Hi guys, I'm Penelope. Today I have two drinks. This is a liquid IV in a GT water bottle, and it's not the best thing, but I'll give it a 6 for the hydration factor because that's why I'm drinking it. And then I also have some water in my Awala. Love that. Water I guess needs to be a 10 because it makes up 70% of our body. Like,
Yeah.
you need that.
Period.
Um, I am 21 years old and I am from just outside of Atlanta and I go to Georgia Tech, go Jackets, where I study international affairs and French. And I think that's it. Oh, I was diagnosed in November 2022 and I completed like my initial mainline chemo last July, and then I had a lung surgery to remove two small 1 and 2 millimeter size nodules, one in each of my lungs in September. And then I did have a recurrence of a really big recurrence in a bunch of different spots in my lungs in November. So that was unfortunate. But my experience with lung surgery was not bad. But we'll get more into that later as well.
All right, Jasmine, it's all you.
All right. Hi, I'm Jasmine. I'm 23. I live in Southern California, like about an hour and a half out of LA. Right now, I'm going to Cal State San Bernardino. I'm studying biology. I was diagnosed with osteosarcoma in March of 2019 uh, in my left distal femur, and I've had so many surgeries since then. I first had the limb salvage surgery for my leg, and then I did the two thoracotomies, and I had after that a recurrence in my leg, so I had an above knee amputation, and then a recurrence in my lungs, and so I had a lobectomy, and then recently I've been just doing lots of ablations, and yeah, so that's pretty much it. Oh, I'm drinking today some Gatorade because I also need hydration, and it's the cucumber lime flavor.
Mm,
Kind of interesting. I feel like some people either really like it or they really don't. But I'll rate it an 8 out of 10.
sounds very refreshing.
It is.
All righty. So how about we just jump on in and start talking about our stories, our experiences that are totally not at all traumatic. Um, so I guess I can start a little bit. So my story of when I found out that I needed lung surgery is actually a little bit funny. So I went through MAP, had a limb salvage, and I didn't have any lung occurrences. They were scanning my lungs a lot and making sure I was clear. And they're like, "This is great. You can go back to school." Um, we did see two things on your last scan in your lungs. They're really tiny. Just go back up to school, come back in 6 weeks for a scan. I knew then. I was like, no, this is coming back. Because I had obviously heard about osteosarcoma metastasizing to the lungs. And, I spent that, I moved back to Seattle, went up to the University of Washington. Definitely much harder on a hilly, stair-ridden, slippery campus that's always raining. When you live on the third floor of your sorority and you have a top bunk, and everything is brick. So probably not my best idea, but the friends I made along the way were worth it. I did come back. I moved back home for winter break. And that's when I started ice for my lungs, which is a chemotherapy regimen that a lot of us have been on. And then I had two thoracotomies in March of 2020. For those of you who don't know, it was the very beginning of COVID, and they didn't know what to do with me because COVID was obviously, it obviously affects the lungs a lot. So they didn't really know how to handle COVID, and I was having major lung surgery. So they wanted me out of the hospital as quickly as possible. And so my first admission, I was in for 10 days. And I was in a lot of pain. I had an epidural, all that jazz. And they sent me home. And then about 11 hours before I was supposed to be at the hospital, which I did not know, they called me to say that my surgery had been moved up by about 3 weeks. My second lung surgery which was supposed to be 6 weeks from my first one, was now about 2.5 weeks after my first one. And so that's just because they didn't know what was going to happen with COVID. And then they kicked me out of the hospital a little too early for my liking. So basically with thoracotomies, what they do, usually, again, everyone's experience is different. They go into your back. They usually make this swooping cut. Just do it, and very Nike-esque. And they go in, they spread your ribs, they cut through muscle in your back, and they remove lung tumors and stuff like that, stitch you back up, and it's usually a pretty rough recovery. And yeah, I remember when I heard that I needed lung surgery, I was actually out to lunch with both of my parents. They're divorced, so that was weird, but good. And we were sitting at the bar at our favorite restaurant, and my mom ordered me a very expensive shot of tequila because both of us kind of knew that this was a not celebration, but just let's make this moment special because we know tomorrow you're going to hear that you need surgery. So it is a memory that I look back on fondly. I still have the picture. But since then, I've done a bunch of ablations, and yeah, I feel like I've been talking for forever. So please, someone else go on in and take over.
So Walker, what was your reaction to hearing that you needed lung surgery?
So my reaction was, it was a little different than I think most people, because as soon as I was diagnosed, right after all my scans, they told me about limb salvage, or like I was gonna have an option for my leg. And then they also said they had already seen enough nodules in my lungs that I was gonna eventually have to get lung surgery at some point throughout treatment. So I guess it was a surprise, but at the same time, like being told you have cancer at 15 was like a surprise as well. So it just kind of conglomerated into like one big, like, this sucks. Um, and then I went in for, I think it was like around my 1.5 year, like, annual scans after I was done with treatment. And they saw a nodule on my CAT scan. And they're just like, okay, we're gonna watch it for a month. And I was like, that's not gonna be good. So then, yeah, go in that month later, and it had like doubled or tripled in size. And that's when they were like, okay, now we're gonna have to do surgery. So went in and had the thoracoscopy, and I had a thoracotomy for the first one. I think the hardest thing about the month is they're like, you could do it right now, or you could wait and see. And it's like, I felt bad because I think my family really wanted me to just go ahead and get it done because they were like, what if it gets worse? What if it's
Yeah.
inoperable after this month? And then I was in my head like, well, what if it's fine? And then I get another unnecessary surgery because my first surgery, which was a thoracotomy, they went in for those nodules and it ended up that they were benign. So I had a pretty serious lung surgery for no reason to start. And then ended up, it worked out that I got lung surgery. But yeah, I think it's difficult kind of making decisions for yourself and then for those that are around you too.
It definitely is. It definitely is. And I know that not everyone is given the same options, and there are some people who have plenty of them. So Jasmine, what treatment options were you given? Were you given options or just told which procedure you would be having?
Yeah, so my lungs are complicated, as my oncologist likes to say. Uh, but so for my first two thoracotomies, it was pretty much straightforward. Like you're doing lung surgery or like you're doing thoracotomies. Like I used to always ask him because I was super stressed, like, okay, can we talk about it? And he's like, we'll talk about it when we get there. Like, don't worry about it. Like making it seem like it's no big deal, you know? But then after those two initial thoracotomies, um, I had my first lung recurrence, and it was pretty scary because the lung surgeon told me, like, pretty much to get everything out with thoracotomies, you'd have one lobe of your lung left. And I was like, oh, cool. That doesn't seem like a good idea. So we kind of came to a compromise, and that's when she recommended just doing one lobectomy. And then with the combination of the lobectomy and radiation and ablation, that was like their plan to like do all three to try to like divide and conquer. Um, so yeah, I've been given a lot of options, and so I've used all of them so far.
Sweet. And I know that I only know this because we are friends and you're literally coming over
Yeah,
here later today.
yeah,
But I I remember hearing about one of your thoracotomies. The most impressive one, if I say so myself, you were actually the first at UCLA as an
yeah.
osteosarcoma patient to receive a thoracotomy with this new multi-million-dollar robot. So do
Yeah,
you want to touch on that at
that
all?
was pretty. Yeah, I forgot about that. Sometimes there's just so much like I forget.
Chemo brain.
Yeah. But yeah, that one was pretty scary as well because she was like, I believe that one was a lymph node in my. I don't remember exactly where it was, but it was like close to the a bunch of stuff that was like if it gets damaged, like it's bad. I believe like the blood supply to half of my body or something like that. I don't know. It was a lot. So she at first wasn't sure what she wanted to do about that. She told me she was going to make like an incision in my throat to get to it. But then she changed her mind. And, a lot of the times she kind of downplays like how good she is, I feel like, because
Yeah.
she's like, I don't think I could do it. And then after the surgery, she's like, I did it. It's fine.
Yeah.
I believe she took like 3 or 4 hours to do just that one. She told me it took her a lot longer than she thought it was going to take. But I'm really grateful that she was able to do that because, especially with that one nodule being around so many like vital like nerves and all that stuff, like it was really great. And I didn't even know I was the first person. She told me like 2 years later. She was like, yeah, I give talks, and I give talks about how you were the first person I ever used the Da Vinci robot on for osteosarcoma. And I was like, oh, I didn't even know that. So I feel like that's pretty cool. I don't know.
It's really cool, and
Yeah.
I remember geeking out over it. Obviously, as both your friend and an osteosarcoma patient,
Yeah.
I was like, hell yeah, I want to see this get done. Like, save my girl Jasmine, like get in there, you know?
Yeah. Yeah.
Cam, what about you?
Yeah, so pretty much at my treating hospital, um, thoracotomy is like golden standard of care. I was never offered a thoracoscopy or the VATS procedure. It was always we're doing an open thoracotomy. And um sometimes I wish that I was, given some other options. Down the road, in 2021, I had a relapse that was relatively small, and I don't know the exact reason because I relapsed literally 8 times. I lose track of um the reasons of why things can be done, but for some reason they could not operate this one. So I was recommended to do SBRT radiation therapy. Um and that I had 3 days of radiation. That went really well. And then my most recent relapse, the tumors were inoperable. So they were like, we can either take out your entire left lung and there would not be clear margins. And so you would need radiation anyway, or you can do radiation again. And I was like, I'm gonna do some radiation. I'm gonna do some radiation. So yeah. My hospital is weird. They only really do the thoracotomies. And they don't offer ablations. They don't do like the microwave ablations. They don't do cryoablations. Like they don't do any of that. So yeah. But next question for y'all. Penelope, how do you deal with stress going into a lung surgery?
So for me, I kind of feel like sometimes when I've got like procedures planned and things like that, it's kind of just like go, 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 go. And I actually traveled for my lung surgery. I'm from Atlanta and I went to Nationwide Children's. And honestly, for me, this is probably going to be like a really weird opinion, but like I kind of don't mind having surgeries, like minor surgeries, because like I don't know, it's kind of comforting. Like you just go in there and like they just like treat you so nicely and you're just kind of like it's out of my hands.
Yeah.
There's always like the stress. I remember I had a biopsy on my lung tumor that recently, and like for that I was a little bit worried because I didn't know like there was always a chance that like the tumor could have been like liquid and then it could have spread more and like the biopsy could have made like or like the healing process could have made it grow more or something like that. So I was nervous about that, but really just like for me, knowing that it's just kind of out of my hands and the best thing I can do is just like relax, that kind of helps for me. But um, I bet other people have had other experiences with that as well.
Yeah. I mean, I agree with you in terms of, like major surgery versus like a smaller procedure. Obviously, it's much easier going into a smaller procedure. Jasmine and I get the cryogenic ablations done a lot by the same interventional radiologist who is lovely. Love his team very much, and he cares a great deal about the two of us, which is really sweet. Um, and so we have these done repeatedly. This is with cryogenic ablations. I like to call it the stabby-stabby, freezy-freezy. So basically, they just sedate you a little bit. Most of the time, you're usually face down. I prefer the ones where you're face up because you can actually see the screen. I know Jasmine and I were both pre-med for a very long time. Jasmine, I think, is still pre-med. So they take these long probes and they're basically just needles. So they locally numb you and you're sedated. You get that yummy IV Ativan. They usually throw in some Versed too, or some morphine. Beautiful cocktail. And then so you're just kind of chilling on the CT table. And the ones where they go, through your chest, they just take like these really, really long probes and then they just hold it over the growth and they're like 1 to 2 millimeters, like at the smallest. Like they're barely noticed, like by the naked eye, you can barely see them. They'll go in and just blast it, freeze it, it'll kill the cancer cells. And it gives your body the opportunity to kind of go in to the dead cells, pick up on what they are. So hopefully your immune system has a better chance of fighting the cancer itself. So it's a really cool procedure, super minimally invasive. Like you're not really supposed to, but I've even driven the next day. Again, we live in SoCal. It's a necessity. So yeah, but the stress of major surgeries like thoracotomies, I feel like it's very similar to anxiety. in the sense of, it's completely not in your hands. Your doctors are going to do the best that they can, and that they're just the messengers essentially to what's going on in your body. So there's very little you can do. I obviously like hanging out with my friends, eating like my favorite foods, uh, just kind of like I like to also set boundaries in advance with the people who are close to me, just to be like, hey, I might not be as responsive as I normally am for the week because I usually get really, brain foggy when I'm on pain meds. So I may not be as responsive, or, my throat hurts from being intubated during the procedure. So it's going to be really hard for me to talk on the phone. Are you cool if we just text? So there are ways to kind of navigate life that help me deal with the stress post-op as well as pre-op, by kind of just like nipping things that I know would bug me or be obstacles ahead of time.
Yeah, I definitely think that some of the stress from going into a surgery, and by the way, I had a thoracoscopy, thoroscopy, not an open thoracotomy. Um, a lot of it is like just stress about what's going to happen after the procedure. So I feel like a good way to kind of mitigate that is by being prepared, like having like kind of things set in place. If you have, like we were discussing, like things you bring, which we'll get into later, like having a book, like I like reading after my procedures. Having those sort of things ready can help mitigate that stress for me.
Yep, definitely. So Cam, what was it like right after pick a surgery? Just
Pick a surgery, any surgery.
spin the wheel.
So for me, it would go two ways. I've had two different surgeons because I was operated on by the chief, and then he retired, so then a new guy came in and he kind of did things a little bit differently. So when I was operated on by the chief, I would usually just wake up in the what's that, the recovery. This is like the normal recovery.
PACU?
The PACU. PACU. I was like, is that the PICU and PACU? Different things, different things.
Very.
Um, very different things. So I would wake up in the PACU and then go to just like the main like surgical floor. Um, Now I'm operated on by this like newer guy, and he, as a precaution, sends all thoracotomies to the ICU for pain control, um,
I like
and
him.
any complications. So I would just wake up in the ICU, got my own little bay, got my own private nurse waiting on me hand and foot. Um, but
They're like, I see you. I see you.
um, but I I mean, it is very foggy. I mean, you're coming off of the anesthesia, narcotics are usually on board at that point. So you're pretty groggy and you're oftentimes in pain. So a lot of times I'll be screaming, crying, just to be real with you guys, to know what to expect. Like it's gonna hurt, but advocate for yourself, say, I mean, you don't have if you're screaming and crying, they'll understand that you need pain meds. And they will give you pain meds, and they will make sure that your pain is adequately controlled. And the great thing about going to the ICU, even though it's like scary, like the ICU is not for sick people, like especially for me, you have someone one-to-one with you, making sure all of your needs are met. So that's kind of what it was like right after surgery for me. Jasmine, what was it like for you?
So for my first two thoracotomies, it was rougher than the third one because it's like you just don't really know what to expect. So I remember waking up being super groggy, and then like once the anesthesia kind of wears off, just being like in so much pain to the point where it's like I feel like I can't breathe, and then that freaks me out, and then I start crying, but then that makes it hurt more.
Yeah.
So it's just like this whole thing, like, and so it's just like I don't know what to do. Like you're kind of like hyperventilating because like breathing hurts, crying, like,
Yeah.
and but then it's like once they get the pain meds figured out, then it's like okay, then it gets better, you know. But I learned my lesson from those two, and for the third one, I told them beforehand, I was like, I'm going to wake up in so much pain. Can you please like give me preemptive pain meds so that doesn't happen. And so as soon as I woke up, I told them, I was like, I need pain meds right now. And they're like, okay, like, so I didn't have the crying episode with the third one. I worked it out. But yeah, that's pretty much how I remember.
What people also don't tell you, which was so frustrating, is how much yawning and sneezing hurts.
Sneezing is the worst.
And
Even laughing.
and
Yeah.
laughing so bad. Like,
Laughter is the
I would
best
have friends
medicine in my
come-
ass. Like
I would have friends. I would watch the narcotics would make me like so giddy, like so easily to laugh. So I'd be watching a TikTok and I would be crying like, oh my God, like I gotta put my phone away. I gotta turn the phone off. These damn phones. Like also, I forgot to mention, you usually wake up with a chest tube,
Oh
unfortunately.
yeah.
It's very uncomfortable.
I had two. Yeah, that was not fun.
You had
Both all times. I had two every time. Yeah.
And then when they clamp them to see if there is air in the lung, and those scissors are so heavy. And so when you get up to walk around, it's like pulling
Yeah.
where your chest
It's
tube
also
is.
like
No.
you're trying to make sure they're not tangled up. And like you got to figure out where to put them, like on the walker. Like you get a little system, like, okay, I'm gonna put this one on this side, and I'm gonna put this one on this side. And then if you still have like the catheter or whatever, you're like, okay, I'm gonna hang that here. It's just like tangled mess.
One time, an X-ray tech pulled my chest tube out, like a portable. Yeah, she was pulling the board out from behind me and pulled my chest tube out. Yeah, it was really fun.
Oh my God.
I had like 16 doctors come into the room and like put their hands over the
Oh my
thing, and
God.
then I got air on my lung and I had to get another chest tube.
Oh yeah,
Oh my God.
not the same thing, but they took out my chest tube too soon once. And then they were like, okay, we got to put one back in and we can't put you under because you just ate. So we're going to do it right here, right now. And I was like, okay. It was really scary, but it's fine. It worked out.
They had to put my chest tube back in after they took it out too, because they did an X-ray and I had air in my lungs still. But I didn't have to. I still got like I was in the OR sort of area. It was interventional radiology, and they gave me some like pain medicine. Like I was still awake, like chatting with them, but I didn't have as much of a traumatic experience as y'all
Oh
do.
no, mine was
But I did
super
have-
traumatic. Like they did it in my hospital room, and like they like draped me, and like I had the surgical drape over me. I couldn't see anything.
Oh,
And
no,
then
no,
like
oh my
the
God.
guy that did it was kind of a jerk, honestly. Like, and I remember he kind of like ripped the tape off really hard, and so like I was crying from that, and I was like, I can't believe I'm crying for the tape. That seems like such a ridiculous thing, but it hurts so bad. That's like the worst
What's
part
his name?
for me, I feel like.
What's
Name
his
know. I
name?
have-
I
I have a name for him,
address.
but I don't think I could say what my name is for him on here. So
And
It'd be like that. Oh
Yeah.
God. I remember how rough that was for you. And I just
Mhm.
we've all had just those brutal experience. I mean, lung surgery is just, it doesn't matter how minimal it is, it's still like
Yeah.
it's a very vital organ. It's like
Yeah.
it's their lungs. You need them to breathe and have oxygen in your body. So yeah, how successful were y'all's surgeries? I feel very lucky that I only had two thoracotomies. They were relatively successful. I was stitched up beautifully. Shout out to Yanagawa and her team. And those, obviously the pain was intense for those, but they got 14 out of the left lung and 15 out of the right, I think, somewhere in that ballpark. And so then, I did some more chemo after that and just recovered, and it was pretty brutal. It was right after COVID, right in the middle of COVID, right at the beginning. But they were relatively successful. And then once more things started popping up, they kind of were like, hey, we're going to try this new, cryogenic ablation had been around for a while, but it hadn't been used on lungs very often. And our IR doctor was trained by the guy who essentially invented cryogenic ablation for lung tumors. So I've had upwards of 25 cryogenic and microwave ablations at this point on both lung and bone, predominantly lung. And the ablations are very successful. And Jasmine, I don't know if you want to touch more on them, but I'm gonna throw it in your direction.
Yeah, so I think the ablations are super successful, especially for someone like me, where it's like they said thoracotomy really wasn't an option based on like how many things I had and how much lung tissue it would take out and all that stuff. So I'm so like grateful, honestly, to have another option, especially a minimally invasive option like that. So those are super successful, I agree, because it's like I know if something pops up, like it could be taken care of, which is kind of like a good feeling to have.
Mhm.
And for my first two thoracotomies, like they were successful. I was good for a really long time after those. So, but in my thoracotomy, like even though it sucked, it was successful also because the whole reason for doing it was like all of the doctors were kind of hesitant to work on my lungs because of how complicated it was. So it was successful in the sense that taking out that lobe made it possible for me to have the other therapies. So yeah.
Sweet.
Yeah, for me, I will preface this again by saying I am not a doctor, so please take this with a grain of salt. Um, my thoracotomies, for the most part, got the job done. But oftentimes, I would say majority of my relapses have been regrowth on suture lines of previous resections, which sucks. But that is kind of how sneaky osteosarcoma is. It just
Mhm.
likes to do that. And I am by no means saying that is going to happen to you. Don't get a thoracotomy because thoracotomies are the gold standard treatment for osteosarcoma. And I've been kept stable and no evidence of disease for a long period of time after having a thoracotomy. I think the longest I went, I just, I, one relapse, I got a thoracotomy, did no treatment. I was good for, I think, 18 months. So, like, I would say that's relatively successful. Um, and obviously, this is not a surgery, but it's an alternative to surgery. The SBRT radiation, super successful for me. That one nodule that couldn't be removed surgically that I had done in 2021, has not grown back. And I had SBRT again in October of 2023. My scan from December was stable, no growth. I have scans March 18th to see if that trend will
I
continue, but
have one the 14th.
when the osteo girls are on the same
Beware
scan.
the Ides of March. Um,
But yes, that caveat about thoracotomies, that's what has happened for me. SBRT, we love her.
or
Walker, what about you?
Yeah, for me, I was really lucky. I think overall, like my surgery was successful. For my first surgery was a thoracotomy, and that was because of suspicious nodules that they could see in my CT scan, but there was no way to tell whether it was cancerous or not. So it was kind of like a flip of the coin whether or not I had them in both my left and right lungs, and so it was kind of like flip of the coin left, right. I'm left-handed, so I was like, well, let's do my right because they were like, it's gonna affect like your movement and stuff for a while. So I did that, and then I think I already said, but came back benign, which really grateful for that. And then, like I said, went in for a checkup, a scan, about a year and a half later, and there was now more nodules on the left side. So bad flip of the coin on my part. Probably should have gone to the left side to start, but they went in and did the thoracoscopy there, and so that was successful as well. I mean, chest tube sucked, but overall it worked out, and then haven't had any problems since. But it's definitely something like I always think of, probably weekly, daily, of like it once it goes to the lungs, it's just I don't know. Everything I've seen, it's scary. So something
yeah,
you think of a lot for sure.
it's really spooky.
For me, I had a millimeter to one 1 millimeter nodule on my right, and then a 2 millimeter on my left, or maybe it was the other way. I'm not sure. So I had a thoracoscopy, and I did both at the same time because it was just kind of small, and I woke up with two chest tubes, and I was kind of in and out of the hospital for 3 weeks following that. Um, and then I went in for and so my nodules, one came back dead, the other one came back viable. And so we were trying to figure out my next steps for treatment when I went in for my 3-month scan. And I got my scan, and then I had a massive growth and several other growths that came back. And I found out they were unresectable. And when I went into that scan, I had no thought that that's what was going to happen. And even after I had that scan, I had a PET scan to see if those were cancerous, because I was thinking there's no way like that could happen, that would have grown that fast, because it was very big. It was like 5 centimeters. So I went in, and yeah, I had no thought that was going to occur, but it does occur in apparently like 10 to 15% of patients. That's like a number that my doctor threw out at me. Again, take that with a grain of salt. I'm not sure. Have that really quick relapse. And I wouldn't have done anything different. I think I made the right call on having that thoracoscopy. But yeah, I guess so in the sense that it removed those two nodules, it was successful. But in the sense that I was not NED after that, it was unsuccessful. But again, I wouldn't have made a different choice. It's just kind of what happened to me after my surgery. And so yeah, right now I'm on Stivarga, regorafenib,
Yep.
TKI.
Very familiar.
Yeah. So that's currently where I am now, until that stops working. But for now, that's where I'm at with my treatment.
Wait. Cam, Jasmine, I know you both have had so many different procedures, and would you, if you had to, are there any procedures that you would do again, or would you rather explore other options?
I would for sure, like, I'll do ablations for the rest of my life if I have to. Like, I don't mind, like they're fine. I would for sure do those again. I would rather not do a thoracotomy if I don't have to, but again, like if it's necessary, like I'll do it, but only if it's like the only way.
Yeah.
And I kind of wish that I had been told about ablations earlier, because I feel like it could have saved me some trouble
Yeah.
if I had known about it sooner. So
I hope that they expand access to these procedures,
yeah.
because they're truly life-saving. I do not believe that I would still be here today without ablations, just because there are so many tricky spots they can get into. Like, Jasmine, I don't mean to just
Oh no,
share
it's
your
fine.
story, but just I think it's so fascinating that what our doctor has figured out is that if they're kind of in a weird area that's a little too close to a blood vessel or a nerve for his liking, he'll blast compressed air to move growth and then
Yeah,
remove it
so
from there.
yeah, that happened. I had one that was close to I think it's called the brachial plexus, which is like the blood supply to your arm. And so he inserted a chest tube to blow air in. It was like a real small one. And they removed it like right after. But yeah, it did hurt, like having that blast of air being put in there. So that was kind of a weird feeling. But yeah, that was pretty crazy. Like he's super inventive, I would say, because sometimes I feel like someone will look at that and they'll be like, no, can't do it. So that's really nice. And then I also had a nodule on my 12th rib, and that one was close to my colon. So instead of air, he actually used fluid to displace that one, which was pretty cool. He pretty much like pushed my colon away. I was really swollen for a long time though, and that one hurt really, really bad. But because it was like the nerves and stuff in the rib, but again, like I don't know if I would have a different option without the ablation. So I would do them for everything if I could.
Yeah, I'm kind of in a similar boat with you, Jasmine. If it's 100% necessary that like a thoracotomy is the only option, yeah, I guess I would do it. But when there are options that have been so successful for me, like SBRT, um, which it's super high tech the way they do it. In Boston, they use an MRI guided linear accelerator. So they're taking scans pre-treatment. They have a physicist mapping out your tumor, so it's the radiation beams are avoiding surrounding tissues, and like one of mine was near my heart, so was avoiding, and it detects when you are breathing in the correct position, and the machine will turn off the radiation when you breathe out and it's not in the correct spot. So, and it's painless. Like, yes, there's some fatigue, and it's kind of annoying that you have to go in every day, but no chest tube, no nausea, no excruciating pain, no crying. Like I much prefer radiation, and if Boston offered ablations, I would be very interested in that. But yeah, I would get a thoracotomy if it was 100% necessary, but I would prefer radiation.
Camille, do you think that you would consider traveling for an ablation, or is that like something that's like you'd have to go so frequently it wouldn't really be worth it?
It's a good question. I honestly think I would probably discuss with like my doctors, here, like what they think. Especially when like radiation has been so successful. Like there are some side effects like I'll get to later, maybe like some impacts on breathing, but potentially, yeah, I would travel for an ablation.
I
I have
know that surgeries are obviously extremely difficult for patients, but I know how taxing they can be on caregivers, especially since my mom is my primary caregiver. She's really my only main caregiver, 24/7. So, what advice, would you all give and like to a caregiver taking care of someone after a lung surgery? Like, I would tell them, hey, be prepared for them to be in a lot of pain. It's going to hurt when they sneeze, when they cough. Just check on them after that happens, and just be like, you all right? Um, just little check-ins, and just kind of understand that they're definitely going to be out of it. And that blankets are nice, and that sometimes you don't know, the patient doesn't know what they want. They don't know what to tell you to help them, and so that can be frustrating for both parties. So I would just say, even as hard as it is, to try as much as possible for open communication, and between the caregiver and the patient. Even with brain fog, I know how difficult that is. So if this is maybe your second thoracotomy, you just kind of like jot down some things, like even a note on your phone, of things that bothered you, and how you think it can be better. Yeah, I think that is the advice that I would give. Any other advice for caregivers that you guys would give?
I would just say take care of yourself. Like
Yeah.
I can imagine it's very taxing emotionally to like watch your child, partner, etc. go through um something so major as a thoracotomy, and all the tubes, all the pain, all the screaming, all the crying. Like take care of yourself and rely on your support system, whether that be neighbors, other family members. Like I would just say like make sure you have a team of supporters supporting you along the way. Mia, how do you distract yourself from surgical pain? And are there any shows, movies, albums, or songs that help get you through it? Maybe fight song?
Not fight song. If I hear that song one more time, and again, Rachel Platten, go off, you slay. You are an amazing, talented artist. It is a running joke in the cancer community that we are sick of this song. Like, please choose something else. Um, anyway, yeah, what really got my mom and I through some really tough times, was actually Miley Cyrus's Plastic Hearts album. A lot of it is upbeat, but there are still some, some slow jams on there as well. And it's just so fun and positive and silly, and it's good walking music. So it was a great motivator for me to get up and out. Not necessarily out, but just like walking from the family room to the guest room, or just that kind of helped me, and it would distract me from the pain of actually getting up, because it's like, oh, I love this song. And there are also lots of great, bingeable shows out there. Definitely trashy reality TV. We love a Too Hot to Handle moment. A Love is Blind. Traders is a new favorite of mine as well. And yeah, I mean, just that definitely helps to distract from pain, and meditations, I would say. Uh, again, not a professional, this is not an ad. Balance is a meditation app, and it's really great. You can get a free guest pass if you know someone who has it for a year. So if you guys want it, I'll text it to you. Just let me know. Anyway, just find a meditation app or anything that works for you, and it helps so much. The only thing that's annoying is if you need to take deep breaths. That can be a little bit difficult, obviously, after lung surgery. Um, and another thing that I just wanted to note quickly is that you can end up with some phrenic nerve damage, and your phrenic nerve kind of controls your diaphragm. There's one on each side. Again, I'm not a medical professional. Um, I have some phrenic nerve damage just because I've been numbed in the area so much locally from the ablations and from the thoracotomies and all of the other stuff that's been done to me. So I have a decent amount of nerve damage, and it causes my diaphragm to seize up more easily. So anytime I cough from anything, I will get an abdominal like spasm, like right under my ribs, like in the muscle and the diaphragm. And it'll seize up, and then I'll just cough like crazy. So obviously that is not ideal after a lung surgery. So just if you have nerve damage, just bring it up with your doctors, see if they can get you, you know, on something that can help, or if they have any ways to help. A lot of people don't realize the effect of nerve damage during these procedures sometimes until they're in it. So I just wanted to address that. But yeah, Penelope, any shows or movies?
I read so many books after my lung surgery, and it was during school, so like I definitely could have been doing my homework, but like you're in the hospital, you don't want to do that. I think it would have helped me if I had, but that was just not my vibe at the time. Luckily my professors were very nice about it, so it's fine. Obviously they had to be. I was literally getting lung surgery for cancer, but I read like 8 books in like the 2.5 weeks I was in the hospital. And that was like just kind of the theme of my whole treatment. I would just be like reading so many books like this past year. Like I read so many. I'm looking at my Goodreads right now to see what I read. I read The Fourth Wing, which is a really popular book this past year. That was good. I read Red, White, and Royal Blue, which is a really sweet story about the son of the president of the United States and then the Prince of England, and they fell in love. Just really nice stuff. But yeah, that was my main thing. I know some people aren't really up to reading, but that's literally like all I wanted to do. It's just kind of an escapism thing for me.
Mhm.
And yeah, I just did that all through treatment. Like that's really what got me through. And like that sounds maybe dramatic, but if you have gone through this, then you understand like you just need distraction sometimes. And that's what it was for me.
For me, not trying to hate, it's not the best TV show ever, but The Walking Dead has like endless episodes. I'm pretty sure it just doesn't end. So I ended up watching a lot of that. It was good. I slept a lot, so I would wake up and be like, oh, like there's still zombies. Like it works. It's a good show.
Yeah, but it's always good to have that escapism. I'm a big fiction reader as well. So when I have the mental energy, I will lose myself in a book. Like I will very quickly just like pick up, the latest Tom Clancy or whatever, and just flip through it. And escapism is a great release from the horrors of the world that is, the cancer world. So yeah. Um, Cam, any? hot points, tips,
For distracting yourself
just in general?
for surgery in general. Um, let's see. My hot girl tips. Pack your own bedding and a
Yes.
blanket and
Mhm.
sheets and a pillow and a squishmallow frog if you have one. This woman,
Specifically.
Wendy has seen so many chest tubes. She has been scream cried into. Pack things that will make your stay comfortable. You do not want the disgusting stained hospital sheets. You do
Mm-mm.
not want to be smelling like that. Also, bring some stuff that is like soothing to you. Like I would always bring like lavender pillow spray, essential oils, stuff like that. And then bring a phone charger that is long enough so you can plug
Yes.
it into the wall um and have it in your bed and you're not like hunched over. Make sure it's long enough. Pro tip, some hospital beds have an outlet under the bed. I learned that in like 2020 and I was blown away. Also bring an iPad or computer to like watch Netflix on. I'm not proud to admit it, but I watched a lot of Family Guy after my last thoracotomy. But it's just like trashy TV like that is really good.
Mindless.
Yeah, like I don't want to be I can't like process a book when I'm on like morphine, Dilaudid, oxycodone. Like that's personally not my thing. I just need Family Guy. I need some Stewie Griffin, Brian Griffin, to kind of just
Go Griffins.
relax a little bit. And then I guess like preparing like your lungs before going in, my doctors always recommend like try and get up and walk around as much as you can, but like some days like you just don't really want to do that. So it doesn't have to be like going on a walk on like a treadmill or something. It could be like going to Target and getting some snacks or like a new blanket for your stay or like I don't know, going to McDonald's and walking in the drive-through. I don't know, just for fun. Like you have cancer, like YOLO. Like who cares? Just walk in the
Exactly.
drive-through and get some fries or McFlurry. I don't know.
Just
Mhm.
just do what makes you happy.
If they say
Yeah,
something about you walking to the drive-thru, say I have cancer. Like, what about
yeah,
it?
yeah. What
Just
about
say
this is
what.
my Make-A-Wish.
It's the best way to convince people to do things for you is just say that it's your make-a-wish, even if it makes zero sense logically.
I
You
do
just,
that. I do that every once
I
in a
do
while.
that
Even
too. I
if
do
you're too old for
that.
Make-A-Wish anymore, even if you're past age 18, when you legally cannot get a Make-A-Wish, say
I
it's your
never got
Make-A-Wish.
one.
Missed that deadline by 6 months. Still mad about
Yeah, I missed it too.
I
Not
did
by very
too.
much.
Justice for us. Come on, guys.
Yeah.
it.
I went
AYA
to
justice.
Atlantis. I went to Atlantis. It was mid. That's all I'll say about that. But anyway, enough of those shenanigans. We got guys, we told you we get a little crazy and off track, but
And now it's travel tips.
yeah, I mean
That should be good. That should be a next episode. Is how to travel with a limb salvage or as an amputee.
that's such a good idea. Screenshotting that in my brain. My next question is for Walker. How do you deal with nausea following surgery, and do you have any tips for helping with appetite or nausea post-surgery?
Yeah, for me, so for my lung surgeries, nausea wasn't too bad. I mean, pretty typical of most surgeries. And then for appetite for the lung surgeries, everything kind of hurt, just like moving in general hurts because of the chest tube. So just trying to like eat things that are calorie dense, so that way I didn't have to eat a lot or like very often was kind of the biggest thing I tried to do. But for my first, like for my limb salvage surgery, which is like my first big surgery, I woke up and I think yeah, it was oxycodone is what I woke up and they'd already like put that through my IV. And I just started vomiting everywhere all the time. And so they finally figured out that I was allergic to that. So eventually I got switched to Dilaudid, which is very strong, by the way. but that really helped with nausea. So I think just in general with surgeries, if you wake up and you're not feeling great, you got to make sure to let people know, and then make sure they're trying different options. And because it can always just be like a simple thing, like a medicine that's making you sick more than anything else.
Yeah, for me, I am not the type of person to get super nauseous following surgery. And is that because they prepare me to not be nauseous, or is it just because I'm naturally not nauseous, like in response to anesthesia? The world may never know, but typically they put a scope patch on before anesthesia and then they give me IV Zofran in the OR before I wake up. I'm allergic to all other well, I can do Ativan um and olanzapine, but I don't think they would give me that. I don't think they would give me Ativan to wake up from anesthesia. But but I'm allergic to everything else, like the steroids, the Reglan, Marinol, all of that I'm allergic to. So the scope patch, me and her, we're besties, and IV Zofran hits different.
It does hit different.
And
They're
then
also meltable,
yeah,
Zofran.
the ones under the tongue, they kind of taste kind of good, low key,
Yeah.
but maybe that was my chemo taste buds thinking that Zofran tasted good. But
No, I kind of agree with that.
okay. It's not just a me
Not
thing.
controversial.
Okay. And then with appetite, I would just say like eat what feels doable. Um, a lot of the time, like it would just be like peanut butter and jelly toast for me. Um, Also, like, if you feel up to it, like, treat yourself. Like, I had some people send me some, like, DoorDash gift cards, so I would, like, get, like, a smoothie bowl, which was, like, light enough on the stomach. I would not recommend, like, eating, like, wings and a milkshake. Like, I just wouldn't recommend that, even if you don't have nausea, like, from anesthesia. Like, I personally would not do that, and I don't get nauseous from anesthesia. So just pace yourself, don't overdo it, and get those nausea meds on board.
Yeah.
The Marinol definitely helped me with appetite, but it did make me feel pretty loopy. So it's kind of like a if I was okay with feeling loopy and I just really needed to eat, like that kind of helped. Combosine, if you guys have taken that, just puts me to sleep. So if you're just trying to pass out, like, and not feel nauseous, like that kind of works. I don't know if it actually made me not nauseous, but it put me to sleep, and I was not nauseous when I was asleep. So there's something
I
to
mean,
that for sure.
you can't know if you're nauseous if you're knocked out.
It's true.
Exactly.
So, I guess my next question is, what does recovery time look like the first time undergoing it versus if you've had a repeat procedure? I will send that over to Jasmine first.
Yeah, so I feel like the first time is always the hardest because you just don't really know what to expect. I would say my thoracotomy, um, I honestly don't think it took me that long to recover, but I was in the hospital for like 10 or 12 days. I'm not sure because I had it 3 times. I was in the hospital for quite a while because my chest tubes kept like putting out so much fluid and they didn't want to send me home with one. But I remember like after one of my thoracotomies, like going to Mia's 21st birthday party like a week later. So like I mean it just depends, like for me, the recovery time wasn't as bad. Like once the chest tubes were out, I was good. And then the second time it was easier for me because like I knew exactly what to expect. Like, okay, it's gonna hurt as long as I have the chest tubes, and then once those are gone, it'll be better. So that's how I feel like it's different between the first time and then getting it done again. Except that sometimes when you get it done again, you have like you could have some complications like scar tissue and stuff like that. So that might make it a little bit different. But overall, I feel like first time is the hardest.
Yeah, I completely agree with that. I think the first time you just don't know what to expect, and like, especially lung surgery, it was a lot different than any other surgery I've had. I think the most frustrating part was, I'm sure you all know this, but they give you, I don't know how to describe it, but it's got like the long tube onto it, and you have to inhale, and you have to like get to a certain point and be able to have like so much inhale volume plus keep it a consistent, like steady inhalation.
The
And
incentive spirometer.
yes, spirometer, yes.
Uh-huh.
Couldn't think of
Uh-huh.
it, blanking
I
on it.
hate her.
Yes,
Yeah, with her.
We all hate
yeah,
her.
it's that thing's terrible. I hate the spirometer because they're just like, you need to do this all the time and you'll get better faster. I'm like, well, this hurts really bad. And that's like, I feel like I'm pretty sure that's how they kind of base when they're going to take out your chest tube and everything. So, um, not really expecting that the first time. That was very frustrating. And then the second time I kind of knew what I was going into. I knew like the more I did it, the faster I would probably recover. So yeah, definitely. And I think a thoracotomy was a lot different than the thoracoscopy, just from the recovery of the incisions. The thoracoscopy, I mean, it's two little incisions that I don't even think they actually have to stitch. I think they just glue it. Where my thoracotomy, I have a 6, 8 inch scar running across the length of my back. So uh, definitely different from that standpoint. But yeah.
For me, I only had the one oh gosh, excuse me, thoracoscopy. I still don't know if I'm saying that right. Anyway, but so I traveled for that and I was in the hospital for a little bit longer than I thought. I got the chest tube taken out, I had to get it put back in. And then I actually flew home with one chest tube in, which a lot of times like doctors are like really like, don't do that. Let's get crazy. Like, don't do that. But like it was fine. That was not the issue. I didn't have an issue with that. Um, like, again, I'm not a medical doctor. Don't, take what I say with a grain of salt, but like apparently that's kind of a little archaic to be like super afraid of that, but this is just my experience. Um, but then when I got home, I like was at home for a few days, and then I went to go to the hospital to try to get that out because I was sick of it. It was just like a really small chest tube, and it had I don't know, it was just like really small, and I wanted to go back to school, so I went to the doctor to try to get that out, and they're like, actually, you do need to be readmitted because you um still have air in your lungs. So then I went back to the hospital and I was in the hospital for like 7 more days. So with just that one chest tube, but so I didn't have to get that replaced. But I was in the hospital for like 2.5 weeks. So that was not fun, but honestly, it really wasn't too bad. Like it was painful, but just the chest tubes were kind of the most annoying thing. And also when they want you to walk around and you just got limb salvage surgery or like some other like you have some other lower limb mobility issues, that also does suck a lot. But yeah, that was my experience pretty much.
The crutches on the thoracotomy scars. Absolutely not. Absolutely not.
Yeah.
Hard pass on that.
Hard pass. Hard pass. But I guess last question.
Yeah.
How did each type, we're gonna have representatives from each type of procedure kind of share how your procedure affected your breathing long term. Walker, do you wanna kick it off?
Yeah, I can start. I haven't exactly noticed anything for sure, but I think it's also hard to tell because prior to being diagnosed, I was pretty active and athletic and everything. So I felt like I had pretty good cardiovascular endurance and all those fun things. And then after treatment, it was like walking up steps. I was like, ooh, I don't know, like this is pretty tough. So I don't know if that was just laying in a bed for 9 months and not doing anything, because that's going to pretty much make anybody like their breathing's going to be affected. So yeah, it's kind of hard to tell, but I mean, actually last night I was like, I need to do cardio, like I need to get back into that. So I went to the gym here on campus and got on a bike for like 30 or 45 minutes, and I was like, you know what, I'm actually not going to do that again. Because it it's it was not fun. So it's hard to tell, but I definitely don't think it helped my breathing at a minimum.
I can jump in here. So obviously I had a thoracotomy on each lung, and I've had multiple ablations on both lungs. The way I feel like my breathing has been impacted long term, other than the diaphragm spasms that I have from some of the nerve damage. Again, it hasn't been confirmed. This is just my theory. But it is weird that, the left side of my diaphragm will go into spasm and I get the hiccups 10 times more often than I used to. It's a little weird. But yeah, I mean, long term, I feel like it's impacted me mentally as much as it has physically. I used to love swimming. My dad used to teach scuba diving. I used to love going like free diving in the ocean and, like on Catalina Island, which is off of LA, I loved being in the kelp forests. And now I feel like I can't hold my breath for more than 10 seconds. And obviously that's something that can change with practice. But anytime I'm not breathing, I end up freaking out. And I don't know if that's because my body has now associated the feeling of not breathing or struggling to breathe with, say, holding your breath during a stressful CAT scan or a PET scan or an ablation or getting your chest tube out or an X-ray. I feel like the body keeps the score. And when your body is like, oh, when we feel like we can't breathe, there's usually some sort of trauma happening. So that's why it's been hard for me to get active again, like you said, Walker. Like I have a session with my trainer in half an hour, and my sessions, instead of being like an hour of intense strength training and heavier weights, it's now like half of the session is like physical therapy based stretching, and then I mostly do upper body, and that's it. And it's because my heart rate gets so high, not just because I'm not as cardiovascularly fit, but because it triggers almost that fight or flight response in my body that something wrong is happening.
Yeah,
Um,
for sure.
yeah.
Yeah, sorry, just to add on to what you said, I think that starting from zero, where if before you were previously like had, like you said, good cardiovascular endurance, starting back from zero, even if it's just like you could improve, but it's just knowing what you could do to now like what you're limited to is really hard and I think frustrating at sometimes.
Yeah, I agree.
Yeah, Mia, I thought I was the only one that had like the trauma response to deep breathing. People are like, do a meditation, like do deep breathing. I'm like, no.
It took me
Actually,
months.
yeah, like I understand the utility of it, but no. They need to invent a body that does not keep score, basically.
Yeah.
But anyway, back to I'm a representative from the thoracotomy and the radiation committee. So I had 8 thoracotomies. That is going to do a number on your lung function. I had particularly these weren't like four on each, like four on left, four on right. No, it was 6 on the left, 2 on the right. So my left lung, she's not doing too hot. Um, Pre-radiation, I had a minor drop in lung function. Nothing major. I could still sing opera. That takes a lot of breath support, guys. It takes a lot of breath support. So it wasn't like super, super life altering. I could go to Zumba. That takes a lot of, breathing support. The thing about radiation, it unfortunately has impacted my breathing a lot. Um, there's something called radiation pneumonitis, which is basically inflammation of your lung from the radiation. Um, it can appear about 3 months after you complete radiation, and typically, treatments can help it a little bit, but it just kind of takes time to heal on its own. So I'm currently battling a vicious case of radiation pneumonitis for my most recent treatment. Um, and it's particularly bad because of the size of the tumors that were treated. So I'm taking an inhaled steroid. But it was so bad I could not walk up a flight of stairs, and I would be panting, like heavy breathing, coughing, and everyone at school would be like, "Girl, what?" So I called my doctor, and they were like, "Yeah, this is pneumonitis again. It's okay. Just get on the inhaler, and you know, that's what you'll do." Um, so yeah, I haven't gotten like a pulmonary function test post radiation. I imagine it's lower. Um, but yeah, that's that's the tea on that. Um, but speaking of the tea, thank you all so much for tuning into OsteoWarriors, the Osteosarcoma podcast. Be sure to follow MIB Agents on social media at the links in the description for all of the hot goss and intel. Thank you so much to Penelope, Jasmine, and Walker for joining us today. We're your hosts, Camille
and Mia, and until next time,
that's
the
the
tea.
tea.
Bye, y'all. Thanks for tuning in.